When is it too late to start taking hormones after menopause? What are the benefits and the risks of hormone replacement therapy if you start at age 50? What about age 60 or even 70? I'm Steve Goldring, the hormone pharmacist from simplehormones.com. I've earned multiple certifications about hormone replacement therapy. Doctors trust me to teach their patients about hormones, including hormones for women in menopause. Well, let's assume you went into menopause at around age 50 or 51. That's the average. If you've had a hysterectomy, I have a whole nother video that addresses your HRT risks. That link to that video is somewhere close to this video. If you stopped having periods around 50 and had some symptoms that were really upsetting you, things like weight gain, hot flashes and night sweats, vaginal dryness and painful sex, irritability, mood swings, insomnia, every woman's experience is a little different. You know better than I do what you experienced when you went into menopause. The majority of women do have symptoms, and a lot of them are pretty severe. Many women have told me, I just don't feel like myself anymore. The worse your symptoms are, the more likely you are to look for help with your hormones. If at age 50 or so, right after menopause, you started some form of hormone replacement therapy, you would experience two sets of benefits. The obvious benefits: you'd get relief from at least some of those symptoms. Depending on how thoroughly your doctor helped you optimize all your hormones, you might even start feeling like yourself again. But even more importantly than relieving those symptoms and feeling better, you would also get some invisible benefits because you're strengthening your bones, making them less likely to break over time if you take a fall. You're maintaining the elasticity of your blood vessels. You're keeping your blood lipids, especially one called ApoB, at levels that help you avoid heart disease. You're maintaining your vaginal tissue and your urinary tract in ways that prevent chronic infections, vaginal atrophy, vaginal dryness, and urinary incontinence. You're keeping your memory sharp so that you don't gradually decline into dementia over 30 or 40 years. You're maintaining insulin sensitivity. That helps you gain control of your weight, avoid cravings. It also protects your heart, your brain, and other organs from the damage of long-term high blood glucose and high insulin. But what about the risks? Doesn't HRT increase your risk for breast cancer, heart attacks, and stroke? That's a reasonable question. The perception that HRT increases those risks is 100% based on the misinterpretation of a study called the Women's Health Initiative. I go into the details of the WHI in several of my other videos. For now, just know two things. Number one, the benefits of hormone replacement therapy far outweigh the risks, especially when you start HRT right after you go into menopause, let's say around 50, 51. Number two, the right hormones given in the right way have been shown to reduce several risks, especially when you started early. But what if you didn't start HRT at age 50? Now you're 60 and you're still struggling with symptoms. Maybe you just can't take it anymore. What are the benefits and risks of HRT 10 years after the start of menopause? Well, the obvious benefits of hormone replacement therapy will still be the same whether you start at 50 or 60. You can still get relief from your symptoms and start feeling like yourself again. The invisible benefits for bone strength, blood vessels, blood lipids, vaginal and urinary function, insulin sensitivity, those are going to vary based on your individual health. Well, there's no doubt about it, going without hormones for 10 plus years causes some invisible damage. How much damage varies widely from one woman to the next. There's also a lot of variation in whether you can reverse that invisible damage by optimizing your hormones. Ever heard the adage about the best time to start saving for retirement was 30 years ago? The second best time is today. Well, that principle also applies to hormone optimization. The best time to get your hormones optimized was immediately after you lose them at menopause. The second best time is now. If you're over 60, 10 years or more past menopause, and you've had nothing done for your hormones, you tell me, is your health as good or better than it was 10 years ago? Has your doctor told you that you have osteoporosis or maybe osteopenia, weakened bones? Do you have insulin resistance or prediabetes? Have you been informed that you have rising risk factors for heart disease? Sure, There are some exceptions, women who stay strong, fit, and healthy without hormones. Or maybe they look strong, fit, and healthy, but there are some serious invisible risks lurking under the surface. I just had a couple of long Zoom conversations with a good friend of mine and my wife's. She gets tons of exercise. She's extremely disciplined in her diet. She does everything right. She looks healthy, slim, and vibrant. She really hasn't changed in 20 years. But at age 60, she's starting to see some serious bone density problems and some risk factors that she just can't shake by doing HIIT training and yoga and eating right. The title of the Women's Health Initiative study was Risks and Benefits of Estrogen plus Progestin in Healthy Postmenopausal Women. Well, there's been a lot of criticism about the presumption that the women included in the WHI were healthy. The WHI study report states clearly that 69% of those women were either overweight or obese. 50% were past or present smokers. 35% had been treated for high blood pressure. 12.5% had high cholesterol that required medication. The average age of the women in the WHI was 63. That's about 12 years past menopause. The WHI showed that women who didn't take hormones for 10 or 12 years after menopause got less and less healthy, although it could also be argued that they weren't all that healthy to begin with. A woman who chooses not to get her hormones replaced after she goes into menopause is going to accumulate some damage to her organs, especially her heart and her blood vessels. By age 60, possibly, and certainly by age 70, there's a pretty good chance that your blood vessels have developed what are called plaques. Plaques are just an indication of stuff that's starting to build up in those blood vessel walls. The research says that starting hormones long after menopause could lead to those plaques breaking free and moving somewhere else where they could lead to a clogged artery and a heart attack or a stroke. But the key question is whether you have those plaques. Are you personally at risk? If you do have plaques, what's the best way to proceed? Well, those are questions that require experience, training, and insight. You can ask your primary care provider or your OBGYN to help you with your hormones, even if you haven't had hormones for 10 or 20 years. I can tell you they probably aren't going to be willing to prescribe hormone replacement therapy for you. A hormone optimization specialist, somebody with the training and expertise to know exactly what to look for and how to proceed, is really the best person to help you navigate these waters. You absolutely can start on HRT even if you're 60 or even 70, 10 or even 20 years past menopause. But the longer you've gone without hormones, the more important it is to have somebody who really knows what they're doing help you with your hormones. Whether you're 50, 60, 70, or even 80, the most important thing is not the response of an entire population to hormone replacement therapy. That's what the Women's Health Initiative is all about. What's more important is your individual risks, something that a hormone specialist can help you evaluate and minimize. If you're interested in finding a hormone specialist who can help you navigate the waters of menopause, especially if you haven't had hormones and it's been 10 or more years since your last period, visit my website at simplehormones.com/referral. Fill out my referral request form and I'll check to see if I know any contacts near you who might be able to help. If this video has been helpful at all, click the like and subscribe buttons and ding that little bell to make sure you get notified anytime I post a new video. Thanks so much for watching, and I look forward to talking with you again next time.